person can get PCT in two different ways. About 20% of the time, so 1 in 5 PCT patients have a genetic mutation, so that a particular enzyme in their heme pathway doesn't work as well as it should. But usually that mutation by itself isn't enough. There still needs to be additional insults, typically to their liver, to induce PCT. More often, in 80% or 4 out of 5 patients, it's some other underlying liver disease, things like iron overload, things like chronic viral hepatitis, chronic alcohol use. Those are some examples. Diseases or disease processes in the liver then inhibit this particular enzyme to induce PCT. So you can get PCT two different ways, either have a genetic PCT or acquired PCT.
Porphyric cutaneous tarda, PCT, is a disorder that is characterized mainly by skin lesions, blisters and bullae developing on the hands, usually first and foremost, sometimes on the face, the ears, the neck, places that have sun exposure. And it is due to a liver disease with a usually acquired defect in an enzyme called uroporphyrinogen decarboxylase. That's one of the intermediate enzymes in heme synthesis, and when that enzyme is deficient, there can be the accumulation of uroporphyrin and heptacarboxylporphyrin in particular, and once that accumulates sufficiently, it spills out of the liver, comes out in the urine, but also gets deposited in the skin and gets activated by sunlight to form reactive intermediates that lead to this skin disease. Now, it's usually acquired, and the risk factors for getting it are hepatitis C infection, alcohol use, smoking, iron overload, which can be either acquired or inherited, and estrogens. And in addition, about 20 to 25% of patients in the US will prove to have an inherited partial defect in the enzyme uroporphyrinogen decarboxylase. So it's a combination of several things that can lead to the manifest disease, porphyric cutaneous tarda.